Urethral catheterization, a procedure wherein a catheter is inserted into the bladder via the urethra and remains in situ to drain the urine. Insertion of urethral catheter is an invasive procedure that should only be carried out using a septic technique. The following are the indications: to relieve retention of urine, to drain bladder prior, during, or after surgery, to accurately measure the urine output, and to relieve urinary incontinence.
Good afternoon, I'm Clerk Villaruel Lance, and I'll be demonstrating about urethral catheterization. First thing to do is to verify the patient's identity, then explain the procedure to the parents or guardian of the patient, and then prepare the materials needed.
Prepare the following equipment: catheterization pack and drapes, sterile gloves, appropriate size catheter. This table shows you the appropriate size for age, sterile lubricant, sterile water to inflate the balloon, 5 ml or 10 ml syringe, specimen jar, tape to secure catheter to leg, and drainage bag.
Wash your hands prior to the procedure. Observe proper hand washing technique. For the position, the knees and hips should be abducted and flexed. Place a sterile towel under the infant's buttocks. Choose an appropriate glove size. After donning of sterile gloves, cleanse the area between the labia minora with chlorhexidine. Using single anterior to posterior stroke, then discard, then repeat for second time, then third time if needed. The appropriate catheter size for this patient is 8 to 10 French. Check the patency of the balloon by inflating with normal saline. Then aspirate prior to insertion. Lubricate the tip of the catheter with the water-soluble gel. Insert the catheter into the urethral meatus anterior to the vagina. Insert the catheter with a firm and steady pressure, 1 to 2 centimeters at a time. Do not force the catheter against resistance. Once the catheter is in, all the way to the hub, when you are sure that the catheter is inside the bladder, insert the syringe to this port and inflate the balloon accordingly. All effort should be made towards ensuring that the catheter is in the appropriate place by seeing the urine flowing back or easy flushing of the catheter. Once you're in the urinary bladder, check if the balloon is intact. Connect the end of the catheter to a sterile, closed urinary drainage system. Secure the urinary catheter using a tape applied over the skin. In removing the urinary catheter, remove the tapes. Then deflate the balloon by aspirating with the syringe. Ensure that the balloon is deflated. Then, gently pull the catheter out of the urethra.